as she said, amputations, longer hospital stays, and lifelong debilitating issues, all the result of putting off getting medical help when you need it.
So emergency room visits are down in many hospitals because people are afraid to go to the hospital. Kathy Curran has been digging into some of the numbers and looking at the impact on people's health.
This is the second toll of this pandemic. Some emergency room visits are down 40%, others almost 80%. It's important we do what we can to flatten the curve, but some patients are putting their lives at risk because they're ignoring serious health problems.
And it's very much our fear that these patients are staying at home or in their facilities and unfortunately becoming sicker, and then we'll see them at a much later course.
Doctors are calling it COVID-19's collateral damage. Patients in need of help avoiding emergency rooms and ignoring serious issues that are harmful to their health because they're worried about catching the deadly virus at the hospital. Dr. Chris Kowalik is the chair of surgery at Newton Wellesley Hospital and a vascular surgeon at MGH. He says in many cases, the delay in care has led to more complicated outcomes.
We've had to do more amputations and removal of infected parts than we normally would.
Take a look at the numbers at Newton Wellesley. Pre-pandemic in January, the ER handled more than 5,400 emergency visits. A recent snapshot in the midst of the health crisis shows only 1,160 non-COVID ER visits, a drop of 79%. So far in April, they've had only 7 stroke patients compared to a monthly average of 20 earlier in the year.
We realize that it's a frightening time, but we're here to take care of you.
The rest of these health conditions, they don't care if there's a pandemic, and heart attacks are still going to happen, and surgical problems, bad infections are still going to occur.
Dr. David Crone has sounded the alarm about the consequences of putting off treatment on social media, writing that nearly everything he operated on a few weeks ago was gangrenous. Tissue had died because of a severe infection or loss of blood flow.
And by the time they come in, they're often needing bigger procedures than they otherwise would have had. They're staying in the hospital for longer.
So some patients who could have had day surgery have ended up in the hospital for 5 or 6 days or even longer because they didn't get help sooner. If you're having a medical issue, reach out to your doctor if it's an emergency. Show up to the emergency room or call 911 for help. Kathy Curran, 5 Investigates.